Hi, good afternoon. It's Sunday afternoon and it's 2 p.m. So it's time for Ask Dr. Lulu. Is everyone okay? Is anyone out there? Can anyone hear me? What's going on? Say something. Okay, I see Elise. Thank you. I see Casmi Flesher and Brenda Kirkland. Good, good. Yes. So I've got some friends today. How is everyone doing? Give me a thumbs up if you can hear me. You know I'm the queen, drama queen when it comes to having my Facebook Live and having Brenda says hello and having drama with audio. If it ain't audio, it's a crackling sound. If it's not that, my phone is shutting down. It's always something. So if you guys can hear, Elise says she can hear me. Good. Lorena Garza, yes, good. Welcome, welcome, welcome. Welcome, everybody. So it's Sunday afternoon and it's time for Ask Dr. Lulu. And I am live, coming live at you guys today from San Antonio, Texas. If you don't know me before, today, my name is Dr. Lulu. I am a board certified pediatrician with 30 almost years clinical experience. That's a long time, right? I've got 2 teenage boys and 1 young adult male son. And so that makes me a teen expert. Yay! Not really, but still, that's not the reason, but I am a teen expert. So I listened to the 4-hour work week so far this week, and something he said, I don't know whose quote it is, but whoever, I think it was Oscar Wilde, said that an expert is someone who's made all the mistakes that there are in the field. So that makes me an expert because I've made all the mistakes so y'all don't have to. I like that. I like it. So anyway, if you have a teenager, if you know a teenager, if you're a friend of a teenager, if you are a teenager, if your neighbor is a teenager, a mother of a teenager, a grandmother of a teenager, grandfather of a teenager, used to be a teenager, come on, let's talk about teens. In honor of Breast Cancer Awareness Month, we're going to talk boobies all week, tatas all week. So today's topic is self-breast exam, to be or not to be. What's the 411? So if you can hear me well, I see my mom has joined. Yay! Stephanie's in the house. Good. John Mata is in the building. Eldon Red Mills, awesome. Giving me a dance. I like that. Tammy Flynn, of course, never fails, that girl. I love that girl. Naveya Patek has joined me. Earl D. Burrows is in the building. My mom is saying hi, Dr. Lulu. I am so happy. We've got a full house, so let's get started. So we're talking tatas today. If you have a mom, a sister, you're a girl, you want to listen to this. If you've ever known someone who had breast cancer, you want to listen to this. So today's video is going to be about self-breast exams. We're going to get started. Iyore Edesuwan is, oh my God, Iyore, wow, this is awesome. I'm so excited. So I hope you guys can hear me well. So the first thing we're going to talk about is, if you have a friend that needs to be listening to this video, please tag them, invite them, and then sit down and let's talk boobies, okay? So naturally, as a mother who breastfed my 3 boys, each one for 21 months, and then some, I have every right to talk about breastfeeding, breast cancer, you name it. And I know the men who are watching me, I know you guys love your women, so please, please get them to get their breast exams done. So I'm going to tell you guys all about how we even come about having breasts, and then we're going to talk about breast exams and all that. So let's get started. So the first thing I want to mention is, my mom says loud and clear. Awesome. Thank you, Mom. So the first thing I want to mention is, and if you have any questions, oh, by the way, I can read your comments today. So if you have any questions for me, please ask them, ask away. I will try my best to get to everybody's comments somewhere along the line. So when do we have breasts and why, right? So girls obviously well, boys and girls have breasts, you know that, but girls get breast development to the next level. So we're talking really about women. Not to say that men don't get breast cancer. So if I give you an impression at the beginning, I apologize right now. Men do get breast cancer. We talked about gynecomastia in males last week. So if you didn't watch that, I'm not going to tell you. You got to go back and watch it. But we talked about all of that last week. So men do get breast cancer, but women, the numbers are 1 in 6 or 1 in 8, depending on whose literature you're reading. 1 in 6 or 1 in 8. So if you have 7 girlfriends, we don't know. Yeah, if you have 7 girlfriends, between the 8 of you, one of y'all is going to get breast cancer. If you have 5 girlfriends, the 6 of you, one of you is going to get breast cancer. So the numbers are 6 to 8. So somebody please write down 6 to 8 for me. If you can hear me loud and clear, write down 6 to 8. So 1 in 6 to 8 females will get breast cancer. If you're African American and you're listening to me, your kind of breast cancer, our type of breast cancer is more aggressive. It starts earlier. It takes you out faster. So you want to listen to this, okay? Secondly, if you're Caucasian, lucky you, you still get breast cancer. It still takes you out, but yours is not quite as aggressive from what I've read. At least wrote it down. Thank you. And so, why do girls get breasts? So I don't know why. I guess God made it so. But when you're about 6 to 8, so 6 for the African American girls, about 8 for the Caucasians, and maybe even 6 for Indians and Hispanics, you can get breast development as early as 6. So really what we do is when the child is about 6 to 8, depending on the race, we don't get too excited if they have breast development. So the pituitary gland in your brain sends messengers. One of them is LH, the other is FSH. So someone please write LH and FSH. LH and FSH. Okay, Ellie says she's gonna, yeah, sure, that's fine. If you don't edit it, I'll edit it. But yeah, so it's 1 in 6 to 8 females that will get breast cancer. I think she said she typed it wrong, but thank you for saying something. 6 to 8, 6 to 8. Yeah, you guys are hearing me loud and clear. Yes, Stephanie has LH and FSH. So your brain, the pituitary gland in your brain will send these 2 messengers to get working. So they go to the ovaries, in the girls, of course, go to the ovaries and stimulate the ovaries, excuse me, and makes the ovaries start producing the hormones that causes your breasts to start getting enlarged. So like we said last week, boys can have one side enlarged or both sides enlarged. Girls, the same thing. We can have one side enlarged or both sides enlarged at the very beginning. And usually one side may be bigger than the other. And that stuff hurts like mad. If any of you remembers, give me a thumbs up if you remember when you first had breast buds, how those things hurt. You can't even lay on your stomach. You don't want anyone to brush by you. It is crazy painful. True. Luckily for us, as the breast tissue starts developing more and more, you don't have any more pain, but you can still end up having one side bigger than the other. A long time ago, I read somewhere where they said, I think the right side or your dominant side tends to be a little bit bigger depending on who, what side is dominant in your body. But you can have normal asymmetry, which is one side bigger than the other of breast, and that's still okay, not a problem. So remember, first of all, 6 to 8 is the age when girls can start having puberty and therefore start having breast development. 6 more for African Americans, 8 more for Caucasians. So between 6 to 8 and 13, you should have your breast development already. If you don't have breast developing by the age of 13, we might have a problem, Houston. And so you want to talk to your doctor ASAP if your 14-year-old girl doesn't have any breasts. Let's make sure she's a girl, okay? How about that? All right, so that's when that starts forming. 6 to 8 is when you start having breasts, and 1 out of 6 or 8, actually that's easy to remember. So 1 out of 6 or 8 women is going to have breast cancer, and the age of 6 to 8 is when you can start having breasts. I just discovered that. That's nice, right? That's good. And then the second thing is, let me see. And then, oh, my son has joined. Hi, Namdi. Oh, my baby. Awesome. And then the second thing is you can have different shapes and different sizes. So, you know, if you're well endowed, God bless you, you're lucky. But even if you're that well endowed, you can have problems with it sometimes. And if you're not that well endowed, thanks to plastic surgery, I guess you could get where you want to go, right? But it can cause pain. It can cause shoulder pain, back pain. For some people, if you have extremely large breasts or what we call mammary hyperplasia. So someone write mammary hyperplasia for me, and it can be distressing. It can cause a lot of mental or emotional anguish. Miss Brenda has joined the building. Boosty Brad is in the building. Heather Hammerstedt is in the building. I love it. I love it. I love it. I love it. So, so that's what happens. So you get your breasts, and that's what happens with the breasts. Now, I went back to the etiology of puberty and how did we get here, because it's important to know that if your 6-year-old girl and your African American, if your 6-year-old daughter and she's African American has breast tissue, it's okay. If your 14-year-old daughter, no matter what what race she is, does not have any breasts, we might have a problem. And so that's kind of why I wanted to talk about that, okay? And then, so we're going to talk about the real reason why we're here, which is self-breast exam, to be or not to be. I have a couple of providers in the building. Ram is here. Hi, Ram. Brenda Canty, yay! So I have a couple of providers in the house today. So y'all feel free to chime in, put a little, little twist here and there. If I'm missing anything, just add to the fun, okay? Just say something and let me know. And Ijoma Madu Ozibo is in the building. That's awesome. So we're going to be talking about, if you don't know yet, we're talking about self-breast exam. What's the 411, to be or not to be? While I was doing my research, I found out that the American, I want to say, is it the American Cancer Society or something, is actually having issues with I think it was in Norway or in Germany. I think it was in Germany. They had a problem with self-breast exams because they found out that a lot of the girls or the women were finding lumps in their breasts. Most of the lumps were benign, thankfully, but they were getting a lot of people having biopsies, getting, I don't know, mastectomies. I don't know what was going on, but people were getting really excited, and there was a big, thing about it. And they were like, okay, maybe we should rethink this self-breast exam. I kind of sort of agree with that in the sense that if you don't know what you're doing, it's easy for you to cry wolf for normal, lumpy breasts anyway. So we're going to talk about that later. But indeed, that kind of caused the American Cancer Society and other interested groups to start talking about the fact that, okay, maybe not just the self-breast exam is not enough anymore. Maybe we should also include an ultrasound and, of course, a mammogram in the entire cancer screening strategy, okay? And I thought that was neat. So first things first, if you want to do a breast exam, the best thing to do is two ways. You can either lay in the bed, and usually I want you to put a pillow behind your shoulders right there, but you can lay in the bed, or you can be in the shower. So you can put your left hand over towards your left ear like that, or your right hand over your right ear, your right hand over your, what's that? Right hand over your left ear, left hand over right ear, right? To examine. So let's just say you want to check your right breast. So your right hand checks left breast, left hand checks right breast, okay? So left hand goes over your right ear as your right hand checks your left breast. So my way of teaching my patients, and there are many ways to do this, okay? Some people want to go up and down. I prefer to go round and round in circles. I mean, whatever works for you. Let me see. Tammy Stova said hi. Hi, Amanda Roberts is in the building. That's awesome. You guys, I just love this. The house is full today. Tokwe is in the house. Kenneth is in the house. Awesome, awesome, awesome. So right hand checks left breast, left hand checks right breast. So I go in a circular motion. I think the first question is, when do you check your breasts, right? So for me, as an African-American female, because of what I said earlier on, we do tend to have a little bit more aggressive breast cancer. Once upon a time, they said start checking at 35, but now they say start checking at 40. I say if your mother or your auntie or your sisters or everybody in your family have breast cancer history, you probably want to start earlier, okay? One of my friends, Miss Kwavi's mother, is a breast cancer survivor. So she's been having mammograms since she was 35. So basically, there's no one-stop shop like everything else, right? It varies. So if you have a family history of breast cancer, don't say Dr. Lulu told you to start checking at 45, but it's safe to start like at 35, or just talk to your doctor. And then what time of the month? So you check your breast once a month, about 1 week after your periods. And I'll come back to the reason later. So check it once a month, about a week after your periods. And then you can also, for some people who forget, because that we're all human, we're all busy. If you forget, like, what was my period? Was it a week ago? Was it 5 days ago? What was it? Just do what I do sometimes. I was born on the 11th of March. Check your breast on the 11th of March on the 11th of the month every month. Okay, so that is kind of tricky in the sense that you may be lumpy some months, but we'll talk about that later. So you can also potentially check your breasts on a fixed day in the month rather than not check it at all. Okay, I just kind of got creative with my teenage patients who were like, I forgot to check it 2 months ago. Put it on your phone to remind you. That's one way you can do that. And try to check it every single month. And if you have a girlfriend or if you have a wife or a mom, you can also kind of buddy up and you can remind each other, okay, have you checked your breast this month? Have you checked? Because the doctor sees you once a year for a physical. 9 times out of 10, I'm only seeing your body as it is that day. So if everything works out on the day I see you on March 1st and you have absolutely no lump and you develop a lump in October, who's gonna pick it? That's what I always say. Who's gonna pick it? You are, my sister. You are, my friend. You're gonna pick that lump because I only see you once a year for your physical. And just because I said everything was fine in March doesn't mean you cannot develop a lump in December. And so that's why I say self-breast exam is the best screening tool. Now, it's not diagnostic, but it's screening. Now, a week before your cycle, did I say a week after? I hope I said a week after. So before your cycle, you tend to have lumpy breasts anyway, okay? And I think I'm jumping around, but that's okay. That's my ADHD kicking in, but I think the message is still there. You tend to have lumpy breasts anyway. And so if you're checking your breast, they might be tender also. If you're checking your breast before your cycle, you might be calling wolf all the time because you're gonna feel lumps. And so we don't wanna do that. And that's why they said you should examine your breast a week after your cycles have kind of finished, because you don't want to feel a lump and then cry wolf and it's nothing, okay? So how do you do the breast exam? So like I was saying earlier on, left hand over to your right ear, right hand check left breast. I like to go in a circular motion. So you want to kind of go, divide your breast into 4 quadrants. Quadrants is 4 pieces, right? And try to check each quadrant. So you can start from the outside is what they recommend and kind of work your way into the middle. So you can, I always want you to use your entire palm. Do not use the tip of your finger. I don't know if you can see that. Do not use the tip of your finger. You want to use your entire palm, okay? Do not use the tip of your finger because you're not going to be able to get anything. But if you use your entire palm, you can feel what's going on in there. So you want your left hand over to your right ear. Your entire palm is going to be doing the palpating, okay? So you're going to check 1 quadrant. So let's just say the outer quadrant, so bottom right or bottom left quadrant in this case. You want to go up into the nipple on that side. Always start from the outside, from the periphery, and work your way in, okay? And then second quadrant, you want to start again from the periphery and work your way in. I usually tell my patients, when you're massaging it, kind of close your eyes, you see better. Does that make sense? You see better with your eyes closed, you feel better. But you really, I believe that you have vision when you have your eyes closed and you have sight when your eyes are open. And sight is limited, but vision is limitless. So you have better vision with your eyes closed. So eyes closed when you do this, when you perform this maneuver. You want to kind of go from outside, inside all the time and just kind of feel the entire breast. Listen, if you have a breast lump and it turns out to be cancerous, you want to know. You want to pick it early too. So if you're not checking your breasts already from about maybe the age of 16 or so, you're not gonna know what your breast feels like normally, okay? And then if you feel 1 little lump, you're gonna get all excited and it's nothing. So getting used to knowing exactly the contours of your breast, what they feel like on a daily basis is your best defense, okay? So again, you wanna go that. Now I like to go into the armpits, otherwise known as the axillary tail. There's a piece of the breast that goes that way into the axilla, into your armpit. So always don't forget to go that far, okay? And then when you're doing the top part here, the top 2 quadrants up here, want to always go up into that, you see that, your collarbone, always touch that collarbone. Make sure you check all of that, okay? Press it down really good, feel it really good. Feel for any lumps, always, it takes 5 good minutes to do it and you're done for the month and then you can check it off. But if you don't do it right, then we've got a problem, Houston. Okay, so we talked about how breasts kind of got developed. We talked about when you should start checking your breast. I tell my patients to start at 16. I picked that number. I didn't read it anywhere. I just picked it, okay? And I've done that forever. And then I say, if you have a family history of breast cancer, I know some people like Angelina Jolie, I think she has the BRCA antigen or something, and she had bilateral mastectomy. I think I heard that one time. There are the people who have done that, and that works for them. If you want to keep your mamas, then you got to check them, okay? So you do your self-breast exam once a month, about a week after your cycle. Can someone please write that down for me? Let me see. While you're writing that down, I've got Tammy Stover saying, hey, hi, Tammy. How's my girl doing? And Ellie says, is there a best time if you don't get your period anymore? Good question. So I am a pediatrician. Technically, my window does not go that far as to menopausal women. This is a good question. I have Heather in the building. She's an emergency room doctor, so I don't even know if she'll be able to respond to that question. But my guess is probably check with your doctor. If you're already into menopause, still do it every month, but if you have any specific menopausal questions, you probably want to check with your doctor. My age range stops at 21, so I can't really say if you have no periods anymore. You still have breasts, so you can still have breast cancer. So I say just every month and just pick a date in the month. Pick a date in the month. Like I said earlier, I'm born on the 11th of March. So I try to check my breast on the 11th of every month. If I forget when was my period, when was not my period. Okay, so hopefully that helps. If you guys have any other questions, please ask me. I have a Natalie Noel in the building, and Chris Case joined the house. Hi, Chris. Chris is one of my residents at the Air Force. Oh my God, hi, Chris. So if you guys have any questions, please ask them. Again, just a brief summary. We're talking about checking your tatas this month. If you do find a lump, what do you do? So first of all, stay calm, okay? You don't get anything done if you get excited. I'm a naturally excitable person, so I'm going to just say do as I say this time around, because I'm probably not going to stay calm, but that's who I am. But ideally, you should stay calm, check it again, and then get maybe your mom or your sister or someone else to cross-check it with you. If you can isolate the lump, if you can find a lump like a pea size or something that is kind of in the same place all the time, it could be one of two things. It could be benign. The benign breast lumps tend to be more mobile. They call them the breast mouse because it moves around a lot. But if you find a lump that is kind of there, is fixed, it's not moving around, or if there's any kind of puckering of the skin around there, or any kind of change in skin color around that area, it may not be good. Most cancerous lumps are also painless. Painless. If you have a painful lump, it tends to be more benign. If you have a painless lump, it's not as good. Also, one thing I always do at the end of my exam is gently press the nipple to see if there's any drainage or any discharge, because you might, oh, God forbid, blood, or if it's milk, then maybe there's a baby in the building or a tumor somewhere. But it's also, your nipple is kind of part of your breast, but it's a different department. So you want to check your nipples and just kind of lightly just press on your nipples. So let's go over everything again. You want to divide your breast into 4 quadrants, wherever your lines want to go, and then examine each quadrant. Start from the outside and work your way to the middle. Outside to the middle. Don't forget the axillary tail under your armpit there. Don't forget to get those fingers to touch, barely touch that collarbone. There's breast tissue that kind of spreads in there. And always don't forget to press your nipples ever so lightly. If you don't know what your breasts feel like on a daily basis or on a monthly basis, you're not going to know when you have a lump. So please check your breasts every month. Once a month, about a week after your cycle, so all of the inflammation and all of the lumps of the pre-cycle time and all of the tenderness has settled, okay? If you feel a lump, you want to stay calm, recheck it. If that lump is moving around, you can't find it, you can't stop it, it's going around everywhere, it's less likely to be cancerous. If your lump is staying fixed, not moving around, Houston, we have 2 problems, okay? It could be cancerous or it could be cancerous. So you're going to run, not walk to your doctor and have it rechecked. Your doctor is going to try to stay calm as well, and he or she's going to try to order an ultrasound of your breasts, which is kind of like, everyone knows what an ultrasound is. They kind of check to see really what kind of breast tissue is this? Is this something that we should get alarmed about? And probably follow with a mammogram. And then, of course, if they think it's something suspicious, then they might want to do a fine needle aspiration biopsy, which they just kind of put a needle in there and get a little piece of it. Some might want to do what they call an excision biopsy, which is take the entire lump out, or whatever your doctor decides. You want to work closely with your doctor. I hope that this class was useful. I hope that this talk was useful. If it was, give me a thumbs up. I love you guys. I can't see your thumbs up or your hearts, but please let me know if it was useful. If you know something, you have to do better. So now all of y'all that are watching me know the proper way to do a breast exam, a self-breast exam. So you need to have no excuses henceforth to not check your breast. Put it on your phone. Everyone has a smartphone. Make your phone remind you. Do old school like me, put on your calendar once a month, about a week. If you know when your cycle was on March 1st, about a week later, about maybe March 11 or March 10th, do your breast exam. Okay, so around that, always have a backup person to recheck it for you before you get all excited. If you have a family history of breast cancer, I think I only know of one person in the entire world who has a strong family history of breast cancer and does not have any breast cancer. Didn't anybody know her? Miss Patti LaBelle. I believe the story is that all of her siblings and her mom and everybody, they all died of breast cancer, but Miss Patti lives to still tell the story. So you may not have the gene, but most people that have the family history also have the gene. So you want to also be checked for the gene. Breast cancer is not one of those things that you don't want to get checked. Let me tell you guys a story, and she's watching, so I hope she won't get upset. But my mother that I love so much, so dearly, I took her to have a mammogram many, many moons ago. So everything is okay. We drive up to the place. She gets out of the car, walks in the building and says, nah, I don't want to do it. I'm like, what? I promise you, my mom, she's right here. She will tell you, don't do like my mama. Don't chicken out. You know, I haven't thought about that story in a long time. Do it. Just do it. That's what Nike said. And so please, please, please go in, get your mammogram. I'm happy to say that I had my mammogram done in May and it was negative. And I know I posted the results then. I do get my mammogram every single year. And so help me God, I actually check my breast more than once. I have fibromyalgia and it hurts all the time. So from time to time, I just check it. I don't even care. I don't even follow the once a month thing. I just check it. I just be checking. And you can do that. It's yours. I mean, you might as well. So if you have any questions, I'm going to try to answer them. Spunky Sylvia is in the building. Hi, Spunky. Hi, Sally Pedraza. Natalie Noel, I already gave you a shout out. Let me see. Anybody else has anything else to say? All right, and if we don't have any more questions, it's been almost 30 minutes. Thank you guys so much for joining me. I just love all of y'all. Thank you so much for always being there. Miss Elise, shout out to you. My mom, a shout out to you. And just really pretty much anybody else out there. And I thank you guys so much for joining me this afternoon. Don't forget, I have my blog. I have a brand new one coming out today. I'm excited about it. It's called wordsbyblackbutterfly.com. Check it out. I have a brand new one. I'm so excited. It's coming out today. I also have my website. It's called www.teenalive. Oh, I'm not supposed to say www. Sorry. So teenalive.com. I'm a parent coach. I'm a teen coach. I'm a teen expert. I'm a public speaker. And I speak about teen depression and teen suicide, or really young adult depression and young adult suicide. And believe it or not, on Thursday, right here in San Antonio, neighboring San Antonio, 45 minutes away, we had a 12-year-old commit suicide. So I know it has nothing to do with breast exam, but this is me. You know, you can't sometimes separate your eyes from your ears. It's one head. So this poor little 12-year-old boy took his own life because he was being bullied. So it's not going away, y'all. When I was 12, we didn't talk about what? Suicide? What's that? But now it is so rampant. You do want to remember to ask your children if they're thinking of hurting themselves. Go ahead and ask them. Do you ever feel like hurting yourself? Do you want to commit suicide? Come out and say it. It's okay. Ask their friends how they're doing. Find out what's going on with your child. Find out who your child is hanging out with. This is terrible. A 12-year-old committing suicide. You know, his life is not even started yet. We need to stop the bullying. And I know I've told you guys in the past that 70% of people, you and I, majority of us are bystanders while bullying is going on. So it's all of us, it's on all of us to stop it, whether it's at the office, whether it's at home, at play, at school, it don't matter. Let's stop the bullying today. Okay, so I just saw one more person join in, Miss Shanice Basking. We talked about breast cancer in honor of Breast Cancer Awareness Month. We talked about self-breast exams, the fact that you need to have your self-breast exam done. You need to have your doctor follow-up. You need to have an ultrasound follow-up, and you need to have a mammogram follow-up if you find any lumps. Otherwise, those of you who missed the video, just rewind and just watch it again. It was very nice hanging out with you guys. I love you all. I'll see you next Sunday. We're going to talk maybe some more breasts. We'll see. All right. God bless y'all. Peace. Boom. Nice. Okay. Boom, boom, boom. And